great insights. Thank you for that. I'd like to move on to Dr. Mahmood Khan, who I've had the pleasure of knowing for many years now, under different capacities. I first met him when he was at Pepsi Company. He's got a MD, and he also did a fellowship in endocrinology and nutrition sciences before a really incredible career promoting health and now longevity around the world. After serving time at PepsiCo, where he ran, he was the chief medical officer and the chief science officer. He ran global research and development for PepsiCo. He also was president of global R&D at Takeda Pharmaceuticals, pharmaceutical company, and which has global reach. And after that, he became the executive chairman of Life Biosciences, which is a company dedicated to promoting healthy longevity around the world. He's the chief executive responsible as a board member. And then most recently, and this is something I hope we'll hear more from about, because I'm very excited to learn about Evolution Foundation, where he's a chief executive officer. It's really a one-of-a-kind nonprofit dedicated to promoting healthy longevity around the world. So Dr. Khan, please take it away.
Thank you, June. It's always a challenge to follow Anne. I love her energy and her passion. So hats off to the peer. I am relatively new to this field, so I'm going to give my comments and hopefully lead to a discussion as sort of the outsider to this whole longevity or health span field, now having the chance to help contribute to how we think about it. But the discussion and the conversation to start with is why the need for collaboration. And I'm going to answer that by not trying to say, hey, we need to have collaboration, we need to have multi-sectorial involvement. I think the case for that has been very well made by many others, including Anne and Victor. The question really then is, what are the specific areas? If we think about the tasks at hand, we have to increase our knowledge not only at the discovery stage, and I'm not just meaning drugs, discovery of everything, through to the implementation. And if we're going to convert, as one way of thinking about it, all of these inventions that are already known or yet to come, they're not going to become innovations until they're actually in the marketplace. And, as one writer has once written, an innovation is anything, product or service, that changes a person's life. So if you think about it in that context, inventions don't change anybody's life except for the inventor and the author. It's innovations in the marketplace, defining market very broadly, that change that. So in order to get these discoveries through implementation of the marketplace requires every sector along that path to actually play a role. And if we think about the most recent discussions that we all have had around COVID and the vaccinations of COVID, amazing impact. But 10 years of work by DARPA and NIH and the government sector and all the researchers who were the unsung heroes in the background. Then came the private sector and academic sector, and then ultimately the implementation at scale of how to get it into as many people around the world, rich or poor, to actually make a difference. Because it was a common good. Vaccinating a few people was not going to change the outcome until we had critical mass. So that's the global challenge if we use any one of these analogies. To do that, it's going to need, of course, scientists, engineers, all the rest of it, the usual things that we think about. But it's also going to need policymakers, it's going to need governance, and ultimately, one way or another, funding to move this along, which then leads to needing the resources. That is impossible to do on any problem without multi-sectorial collaboration, let alone something as global and as big as this. So the reality of it is we need talent, we need funding, we need institutions, public and private. And in order to make them transformative, we need to learn from the past. And I'm going to just use one or two examples. The internet has changed everybody's life, no matter where you are on the planet. Cell phone technology has changed everybody's life. And when you combine the two in smartphones, probably the vast majority of the planet's humans are touched by this technology. To be provocative for a second, imagine if the internet had been discovered, designed, and deployed just by the private sector. Do you think we would have the global reach if it was done by a company? Probably not. What happened there was the public sector open sourced an amazing platform, allowed it to be scaled. But on the flip side, imagine if government had the chance to now deploy at scale technologies that use the internet. Probably wouldn't have happened. Look at the power of that collaboration with an open source platform funded by the public sector, developed all the tools by the academic sector, and then deployed in the marketplace at scale by the private sector. That is what gave us the internet. And that is what's changed the lives of professors and entrepreneurs in the West and the rickshaw driver in the East, and everybody in between. The poor farmer working out of Africa is leveraging that capability. Imagine that now applied in that collaborative, connected, and inclusive way of cooperating that would change the lives from a health science perspective. So as we look to those examples, I hope, if nothing else, it inspires us to ask different questions. It asks us not only how do we design labs, what are the scientists going to do, who are the heroes that we're going to celebrate for their discoveries, but I always remind people, for every hero, for every star, it requires leaders who can lead from behind, not needing to stand at the front of the room and actually shape the agenda for what the masses and the large population needs. And it needs both of those, the stars we celebrate and the leaders who are really keeping the mission at the forefront of what we need to get to. Recognition becomes secondary to the mission. And how do we do that? And that's going to take diverse talent. It's going to take skills and experiences we don't have, early and late career individuals. And it's going to ask us questions. What are the tools we need? How are you going to make these available to all of these sectors? How do you cross national boundaries at scale? And by the way, our current funding models don't cross national boundaries. I always remind people we have the US National Institute of Health, not the International Institute of Health. The vast majority of funding is within the US. Appropriately, it's the US taxpayer, European Union, UK, Asia. But aging is a global challenge. It crosses national boundaries. So how do we do that? Where do we come up with? How do you create policies and funding mechanisms that reward this high risk, share the risk, so it's appropriately democratized, both on the risk side and the reward side, and what will it take? That leads me, in the last minute or so, to raise the question, as we move forward, what are the new organizational models that are going to look to fund, collaborate, drive, convene, and ultimately allow cooperation to happen? And which is where, when I took on the challenge of evolution, is very much that. And I'm going to, we can get into the details. This is not about presenting about evolution, but setting the framework for what evolution is about. Our vision statement says it all, which is our goal is to expand healthy lifespan for the benefit of all. There's two parts to that. Healthy lifespan for the benefit of all. And if we do not take this global agenda on in an inclusive way for everybody, we are going to increase the difference between the haves and the have-nots, however you want to define that. It's going to take new operating models, and our operating model is very much build nothing that already exists. Leverage what has already been built, leverage what already exists, partner by helping drive the direction, but leverage the infrastructure that exists, the labs that exist, the institutions that exist, because we come with no strings attached. We do not want IP. We do not want a share of the returns. By doing that, we can come to the table with very significant resources saying, how do we use the capabilities you already have? How do we supplement them? But importantly, my last comment is, how do we enable you through our mechanisms and funding to collaborate with the best minds around the world, which your current funding models may not allow you to do? Let me just stop there.
Thank you, Mahmood. Really fantastic comments, and I'm reflecting on your idea about maybe even new institutions or organizations. I certainly think about the National Academy's role in promoting this global grand challenge. This is a de facto institution that has fostered collaboration across national boundaries. Really is profound. And we'll come back to that in a discussion session later. Also, I have a question for you. Given your fantastic background, not many people in medicine have a nutrition background as well, something that is sorely lacking within medical education today. And so you've got a pretty unique background. To what extent can that domain, food and nutrition, science and innovation, contribute to healthier lifespans and equity?
So, by the way, when I went off to the College of Food Science and Nutrition in late 1980s, everybody thought I was crazy going from the medical school to the ag school. 30 years later, it seemed like a good idea. Look, there are lessons to be learned on both the positives and the challenges. On the positives, there isn't an industry that has the scale and yet the fragmentation of the food industry. If you think about agriculture, it is still very much outside North America, a fragmented smallholder institution. That is the way farming occurs, even in many parts of Europe. And so complex supply chains, we can learn from that industry. The ability to reach billions of people in a way that few industries reach, because every human feeds. Every human actually buys their food. 90-some% of the population of the planet buys their food from the private sector. And so, in a very important collaboration between the agriculture and public sector in there, we can learn from them. On the challenges side, if anything, the learning is the food industries try to fit one solution for all. And I always, when I teach this, I distinguish between diet and nutrition. Nutrition is a biological need. Diet is a cultural need. And we fulfill our nutritional needs through highly varied diets and highly varied ecosystems, which are important from a lot of things, if nothing else, its impact on our planet and our environment. We can learn from all of this. And so it'd be interesting to see how the two parts. Thank you for that question.
Thank you, Mahmood.